Oral hygiene involves maintaining a clean and healthy mouth by regularly brushing teeth and adopting good hygiene practices to prevent disease and other issues like bad breath. Regular oral hygiene is crucial for preventing dental diseases and bad breath. The most common dental issues include tooth decay, cavities, dental caries, and gum diseases such as gingivitis and periodontitis. General guidelines for adults recommend brushing at least twice daily with a fluoridated toothpaste, once before bed and once after breakfast. Cleaning between teeth, known as interdental cleaning, is just as essential as brushing since a toothbrush can only remove about 50% of plaque from tooth surfaces. Interdental cleaning tools include floss, tape, and interdental brushes, allowing individuals to choose their preferred method. While white or straight teeth are often linked to good oral hygiene, a clean and healthy mouth can still have stained or crooked teeth. To enhance the appearance of their teeth, people may opt for tooth whitening treatments and orthodontics. Tooth decay is the most prevalent disease worldwide, with over 80% of cavities forming in the fissures of teeth. These areas are difficult to clean with a toothbrush, making it hard for saliva and fluoride to neutralize acid and remineralize the teeth, unlike the easier-to-clean surfaces where fewer cavities develop. Teeth cleaning involves removing dental plaque and tartar to prevent cavities, gingivitis, gum disease, and tooth decay. Severe gum disease is responsible for at least 1/3 of adult tooth loss. Dental sealants, applied by dentists, protect fissures and grooves in the chewing surfaces of back teeth, preventing food from getting trapped and thereby stopping decay. An elastomers strip can help sealant penetrate deeper into these surfaces and can also help fluoride toothpaste reach and remineralize demineralized teeth. Maintaining good oral hygiene between dental cleanings is essential to prevent tartar buildup, which can lead to various dental issues. This involves regular and thorough brushing with a toothbrush, along with the use of dental floss or interdental brushes to prevent plaque accumulation. Power toothbrushes are more effective than manual ones in reducing dental plaque and gingivitis in both the short and long term, though further evidence is needed to determine the clinical significance of these findings. Patients should be aware of the importance of daily brushing and flossing. New parents need to be educated to instill healthy habits in their children. Dental plaque, or dental biofilm, is a sticky, yellow film of bacteria that attaches to tooth surfaces, particularly around the gum line. It reappears soon after teeth are cleaned, which is why regular brushing is necessary. A high-sugar diet promotes plaque formation, as sugar is converted into acid by plaque bacteria, leading to tooth decay. If plaque remains undisturbed on a subgingival, under the gum, surface, it increases the risk of tooth decay and can irritate the gums, causing redness, swelling, and bleeding during brushing or flossing, signs of gingivitis. Dental calculus, composed of calcium phosphate minerals and live microorganisms covered by an unmineralized layer, forms when plaque remains on the tooth surface for too long. This hardened plaque, or calculus, must be removed by a dental professional. If untreated, the inflammation can lead to bone loss and eventually cause the affected teeth to become loose. Routine toothbrushing is the primary method for preventing many oral diseases and is perhaps the most crucial activity for reducing plaque buildup. Effective plaque control lowers the risk of plaque-associated diseases such as gingivitis, periodontitis, and caries, which are the three most common oral health issues. On average, individuals brush their teeth for 30 to just over 60 seconds, but many oral health professionals recommend brushing for a minimum of 2 minutes at least twice a day. Brushing for at least 2 minutes per session significantly reduces plaque and is optimal for preventing common oral diseases compared to shorter brushing times. Toothbrushing can clean only to a depth of about 1.5 mm inside the gingival pockets. However, a consistent routine of removing plaque above the gum line can influence the microbial environment below the gums, potentially reducing pathogens in pockets up to 5 mm deep. Using toothpaste, dentifrice, with fluoride or alternatives such as nanohydroxyapatite is crucial during toothbrushing. These substances help protect against caries and aid in remineralizing affected enamel. Although there is insufficient evidence regarding the caries-inhibiting characteristics of slow-release fluoride glass beads, the use of toothpaste does not enhance the effectiveness of plaque removal concerning gum disease. Some people prefer nanohydroxyapatite over fluoride, believing that fluoride is a neurotoxin. Population studies have shown that regular toothbrushing is associated with a reduced risk of cardiovascular diseases and improved blood pressure profiles. The modern manual toothbrush is a dental tool comprising a head of nylon bristles attached to a long handle, designed to facilitate effective toothbrushing. The handle aids in reaching the back teeth as they erupt in the oral cavity. A toothbrush is arguably the most effective tool for removing dental plaque, thus capable of preventing all plaque-related diseases if used routinely, correctly, and effectively. Oral health professionals recommend using a toothbrush with a small head and soft bristles, as these are most effective in removing plaque without damaging the gums. The technique used in toothbrushing is crucial for its effectiveness in disease prevention. Simply brushing back and forth is not effective in removing plaque at the gum line. Instead, brushing should be done systematically, angling the bristles at a 45-degree angle towards the gums and making small circular motions. This technique enhances plaque removal at the gum line. Electric toothbrushes feature moving or vibrating bristle heads and come in two main types, sonic and oscillating rotating. Sonic toothbrushes have a vibrating head, while oscillating rotating toothbrushes have a bristle head that makes constant clockwise and counterclockwise movements. Although more expensive and less environmentally friendly than manual toothbrushes, electric toothbrushes can be more effective in certain aspects of oral hygiene. Sonic or ultrasonic toothbrushes vibrate at high frequencies with small amplitudes, creating fluid turbulence that aids in plaque removal. The rotating type may reduce plaque and gingivitis more effectively than manual brushing, though its clinical significance is still uncertain. The vibrations and movements of the bristles help break up bacterial chains up to 5 mm below the gum line. The oscillating rotating electric toothbrush removes plaque through mechanical disturbance of the biofilm at a higher frequency than manual brushing. Toothbrushing alone does not remove plaque from all tooth surfaces, as 40% of these surfaces are interdental. Dental floss is one technique that can access these areas. When used correctly, flossing can remove plaque and food particles from between the teeth and below the gums. The American Dental Association, ADA, reports that up to 80% of plaque can be removed by flossing. The ADA recommends including interdental cleaning as part of The tongue harbors numerous bacteria that can cause bad breath, also known as halitosis. Bad breath is often linked to poor oral hygiene and can lead to dehydration and other health issues. Parents are frequently concerned about bad breath in their toddlers but may feel embarrassed to discuss it with a pediatric dentist. If bad breath is noticed in toddlers, immediate action is recommended. Tongue scrapers are specifically designed to remove debris from the tongue. While a toothbrush can also be used to clean the tongue, it may not reach the back of the tongue effectively, and the bristles might be too soft to remove debris thoroughly. Steps for using a tongue scraper. 1. Rinse the tongue scraper to clean it and remove any debris. 2. Start at the back of the tongue and gently scrape forward, making sure to clean the sides as well as the middle. 3. After cleaning, rinse the tongue scraper and remove any remaining debris. 4. Rinse your mouth. Oral care is an integral component of overall health, with growing evidence linking oral hygiene and systemic diseases. Proper oral hygiene practices not only prevent dental issues such as cavities, gingivitis, and periodontitis but also contribute to the prevention of more severe health problems. Poor oral health is associated with an increased risk of cardiovascular diseases, including heart attack and stroke.